It can be frustrating to go to an ENT doctor and ask, what can I do for this ringing in my ears, but not be presented with many tangible treatment options. Unfortunately, many doctors are undereducated about tinnitus, and that can be frustrating. At Treble Health, we specialize in tinnitus, and this video will discuss the comprehensive understanding of the best and the most effective treatment options that are available today. Dr. Michelle Neidleman-Kennedy will lead this video. She has experience at the leading medical center in New York City, NYU, New York University, working as an audiologist with some of the best ENT, ear, nose, and throat physicians, doctors in the world. So today's video will come from the perspective of Dr. Michelle, myself, and our whole team of audiologists at Treble Health to give you the best information on the different tinnitus treatments today. Please like this video so other people can see it, and subscribe to our YouTube channel to stay involved with the leading tinnitus educational videos that are out there. Thank you for being here. My name is Dr. Ben Thompson, founder of TrebleHealth.com, audiologist and tinnitus specialist. Dr. Michelle, take it away.
Hi, I'm Dr. Michelle with Treble Health. While we know that there isn't one singular cure available for tinnitus, we know that there are many different treatment options that are available for managing tinnitus. Tinnitus isn't a disease, but rather a symptom of other types of conditions, diseases, or pathologies. For that reason, many of the treatment options depend on the actual cause for your tinnitus. I've broken down the treatment options into 5 different categories: medical, audiological, psychological, dental, and physical treatment options. Some of the treatment options overlap with more than one category, and that's because the causes of tinnitus oftentimes overlap with one another. So there might be the need to have a treatment that falls into more than one category, or have a set of treatments that fall into different categories, and that's really the nature of tinnitus. It's very multifaceted and different between individuals. The first treatment category is medical. Medical intervention sometimes includes either surgical or medication to help treat whatever condition is the ultimate cause for one's tinnitus. As you know, one of the first steps to take if you start to have tinnitus or you notice a change to your baseline tinnitus is to have a medical workup to determine whether or not there's an actual medical cause for the change in tinnitus. There are many different diseases or conditions that can bring about tinnitus, and oftentimes individuals will get referred for an MRI or to have imaging studies completed on their auditory system to determine whether or not they have a benign growth on their 8th cranial nerve, which controls both hearing and balance. So typically this is completed to rule out the presence of an acoustic neuroma or a vestibular schwannoma. Hence the different names, because you can have a growth that grows on either the vestibular portion, the vestibular branch of the 8th nerve, or on the auditory portion, the auditory branch of the 8th nerve. And these growths tend to be very slow and typically unilateral. But for some individuals, they may actually have a condition called neurofibromatosis, which is a genetic condition that causes these tumors to grow on nerve structures. An individual with neurofibromatosis may have either type 1 or type 2. Type 1 tends to be diagnosed in early childhood, whereas type 2 is usually diagnosed in early adulthood. So if someone is found to have an acoustic neuroma or vestibular schwannoma or has been diagnosed with neurofibromatosis, there's different surgical options, whether it's excising the tumor or using radiation methods to help shrink down the tumor. And for some individuals, it's just about waiting and seeing and monitoring its growth and its effects on hearing, balance, tinnitus. So for some individuals, after having a procedure to actually remove the tumor, they notice improvements to their tinnitus. For others, they don't notice any changes to their tinnitus, and for some, they may notice a worsening of their tinnitus. In one study that was completed in 2014 on 367 individuals with acoustic neuromas that were surgically removed, they found that for 20% of the individuals, their tinnitus actually resolved after surgery. For another 22% of the individuals, their tinnitus improved. For 35%, their tinnitus remained unchanged. Another 10%, their tinnitus changed. And only for 14% did it actually worsen. So you could see that the results following surgery are variable. And again, it may be determined based on the size and the location of the actual acoustic neuroma. But surgery is an option and can possibly help to improve tinnitus in some cases.
This is a short interruption from today's video to announce the Tinnitus quiz. Are you frustrated by your tinnitus? Does it affect your ability to concentrate or fall asleep? If you're ready to find lasting relief from tinnitus, visit tinnitusquiz.com to get personalized solutions and treatment techniques to help you manage your symptoms today.
There are many other audiologic conditions that can also warrant surgical remediation that can possibly improve symptoms of tinnitus. So, for example, otosclerosis, which is a fixation of the stapes foot plate in the oval window, which is an opening to the inner ear. Sometimes when individuals have otosclerosis, they will also start to experience tinnitus. So if they do have a stapedectomy that helps to alleviate the fixation of the stapes on the oval window, they may start to notice a reduction in their tinnitus perception. Superior semicircular canal dehiscence is another audiologic disorder that results in the thinning of the bone in the superior semicircular canal, and oftentimes tinnitus is associated with that. So again, if the dehiscence or the opening or the thinning of the bone is treated surgically, an individual may report improvements to tinnitus. It's also well known if someone has an ear infection and they have middle ear fluid that they may also start to experience tinnitus. And if the middle ear fluid is reoccurring and this is an ongoing issue for an individual, then it may warrant having pressure equalizing tubes put in to allow the ear to drain. Again, this is a fairly simple surgical procedure that can hopefully alleviate tinnitus for some individuals. So this is another surgical intervention that for some individuals helps to alleviate tinnitus as well. And some individuals have physical trauma that has occurred to them that has then resulted in tinnitus. So depending on the amount of physical trauma to their head, neck, or jaw, they may require surgery to help realign the jaw or to help if there's, for example, discontinuity taking place in the ossicular chain, which are the three smallest bones in our body located behind the eardrum. Then some surgery to fix those issues can, in some cases, help to improve tinnitus as well. Another medical intervention that's not exactly surgical, but either your physician or even your audiologist, depending on what state you live in, can perform is cerumen management. There are many instances, and I've seen plenty of patients who reported an onset of tinnitus, and it was the result of having a lot of occluding wax in their ears. And once they had the wax cleared out, they noticed that their tinnitus decreased or disappeared entirely. So this is another reason why it's important to get a medical workup to determine whether or not your tinnitus might be due to wax, maybe it's due to fluid, maybe it's due to some other kind of medical condition. But it's always the first step to take because you never know, and it might be something that can be easily medically remediated. Type of medical intervention that can be used as a potential treatment for tinnitus are medications. So again, there's no specific medication for tinnitus, but because we know tinnitus is a symptom of many other conditions, if you have a condition like a cardiovascular issue, an autoimmune disease, thyroid conditions, if you are taking appropriate medications to manage those issues, you may in turn help to improve tinnitus. It's also important to check what medications you are currently taking and if any of those are ototoxic. Again, many and most medications will list tinnitus as a potential side effect, but the majority of them are not ototoxic. So if you are specifically taking a medication that's ototoxic and you've noticed a change to your tinnitus or a recent onset of tinnitus, it could in turn be a result of that medication. So it's again worthwhile communicating that with your physician to see if there's an alternative medication that you can take or if a change in the dosage could help improve the symptoms of tinnitus. It's worth mentioning too, if you are experiencing pulsatile tinnitus, in many cases, pulsatile tinnitus is something that can be treated medically because the cause of most pulsatile tinnitus can be identified as either being structural, vascular, or metabolic. And again, if you can identify exactly what may be causing your tinnitus, then you might have a treatment plan that can attack it and in turn help to reduce tinnitus. The second form of treatment is audiological. So very similar to the medical treatment, you have to have a set of tests completed before we can start to determine which audiological treatments are available to treat and improve tinnitus. So usually an individual will have a hearing test, and a standard hearing test assesses hearing from 250 to 8,000 hertz. Your audiologist may also have the capabilities of testing the ultra high frequencies. So frequencies above 8,000 hertz, between 8,000 to 20,000 hertz. Testing above 8,000 hertz isn't typically done for a standard hearing test. But in some instances, if your audiologist has the test equipment, they may do ultra high frequency testing if you're complaining of tinnitus, if you're undergoing known ototoxic treatment to monitor any structural changes in your auditory system. And this can be one of the ways for you to see whether or not you actually have some hearing loss. When an individual has complaints of tinnitus, or if they are undergoing a known ototoxic treatment, they typically will have ultra high frequency testing completed because it helps to show signs of potential hearing loss before we're able to see it within the standard audiogram of 250 to 8,000 hertz. It can give us indications as to whether or not there's any hearing loss beginning to happen within the auditory system of one or both of your ears. It also can help to corroborate with symptoms of tinnitus. And with the use of otoacoustic emissions testing, it may help to support, again, that there's structural changes and damages that are happening within the sensory cells of the auditory system before we're able to see it within the standard hearing test of 250 to 8,000 hertz. Tympanometry testing or emittance testing is another test that's commonly done alongside the standard hearing test. And it's a way of measuring how the middle ear is functioning. It can give us information as to whether or not there's any congestion, pressure, fluid located behind the eardrum, or if there's a perforation in the eardrum, or if the cerumen that's in the ear canal is occluding enough that it's actually blocking sound to getting to the middle ear and to the inner ear, to the hearing nerve, and up to the brain. You may also have otoacoustic emissions testing completed, and this is a test that allows us to check for outer hair cell function. Oftentimes, we may not see signs of hearing loss on the hearing test, but when we do otoacoustic emissions testing, we can sometimes start to see the early signs of hearing loss in the sensory cells. And for this reason, it can be a beneficial test to complete if you want to see if you are in fact having some sensory decline that might be associated with your tinnitus. In some rare instances, your audiologist and your ENT may recommend that you have an auditory brainstem response test. This is another test that assesses the function of the auditory system up to the level of the brainstem. And oftentimes, it's used to see if there's any difference between how the right ear and the left ear are functioning, also to check to see if there are any lesions. So in place of having an MRI, sometimes you may get referred for an ABR to see if there are any differences in how sound is traveling through the auditory pathways. If you've been identified as having hearing loss, in addition to complaints of tinnitus, then hearing aids are the likely treatment that you're going to be recommended for. Hearing aids help not only with hearing, but they also help with tinnitus. Hearing aids enhance audition and also in many ways help to reset the neural pathways within the auditory system. So again, sometimes individuals who receive hearing aids start to also notice an improvement in their tinnitus. However, hearing aids alone cannot often reduce the perception of tinnitus, and that's where ear-level sound generators come in, or tinnitus maskers. There's many different terms, but essentially it's a device that you use that helps to create and add in sounds into your everyday life and environment. The easiest way of doing this is through devices that you wear on your ear. So they're very similar to hearing aids, and you can use them with and without the amplification. So again, if you have a perceivable hearing loss and a measurable hearing loss, you may have some amplification in addition to the masking sounds or white noise or pink noise, whatever sounds that the device is producing. One of the theories behind why individuals experience tinnitus is the fact that external environment. And so in some ways, it's starting to self-stimulate and create these sounds. For some individuals, being able to hear more external sounds helps to reduce the perception of tinnitus. And statistically speaking, about 90% of individuals who have tinnitus also have some degree of hearing loss. So again, for many, simply being able to hear better might help them to reduce their tinnitus. It helps to divert their attention away from tinnitus, helps to reduce the difference between what they feel their tinnitus sounds like as compared to all of the background sounds that are around them. But this isn't the case for everybody, and that's where sound generators come in, or masking noise that can be added into hearing devices. There are many reasons that ear-level sound generators or tinnitus maskers work. So the term masking really comes from the fact that it helps to distract your attention away from your tinnitus and helps you focus again on the external sounds that are in your environment. And many constant, non-changing sounds that we regularly hear throughout our day, we ultimately forget about and ignore. And by having a constant, non-changing sound that is playing directly into your ears, oftentimes it starts to blend in with your tinnitus, and over time, your brain slowly starts to attend less and less to the tinnitus. Additionally, it helps by increasing and raising up the noise floor. So the noise floor refers to the level of sounds that are around you. And if you're around an environment that has a low level of noise, then regardless of how loud or soft your tinnitus is, it's going to be very distinct. There's going to be quite a difference between the regular background noise around you and the sound of your tinnitus. And with ear-leveled sound generators, we are raising up the noise floor. So now the difference between the background sounds and your tinnitus has become reduced, thereby helping you perceive your tinnitus as softer, and it becomes over time again less noticeable. It's also believed that ear-level sound generators help with neuromodulation. So because you're sending more auditory information up to the auditory cortex, you're helping to thereby reduce the overactive or hyperactive neural response that the central auditory system is having in regards to tinnitus. Many ear-level sound generators today are also Bluetooth enabled, meaning that if you don't enjoy the sound that the device has within it, you can stream whatever sound you choose. And the idea again is to listen to something that is neutral and pleasant. So if you are finding the sound of pink noise or white noise, which are one of the more common sounds included in ear-level sound generators, unpleasant, then you can decide to stream your rain, wind, ocean, fire, crackle, crickets, whatever sounds you actually enjoy and find pleasant and help you to focus less on your tinnitus through those devices. It's also important to know that outside of hearing aids and standard ear-level sound generators, there are other devices that can help with sound therapy, such as bone conduction headphones, standard earphones, like your AirPods can sometimes be used as sound therapy devices. And you can also consider even using an external sound machine or a Bluetooth speaker to allow yourself to have more sound into your environment and thereby help you reduce how loud and how much awareness you're giving to your tinnitus on a regular basis. There's a lot of supporting research surrounding the use of sound therapy in addition to counseling for helping to improve tinnitus perception. And one study that was published in 2022 found that individuals who were receiving TRT, tinnitus retraining therapy, which included sound therapy devices, improved at a much faster rate than individuals who weren't receiving TRT or individuals that were receiving TRT with like a placebo sound generating device. So as you can see, sound therapy is definitely a very important part to trying to habituate and improve tinnitus. The third type of treatment for tinnitus involves psychological interventions. We know that high levels of stress, anxiety, and depression are often linked to tinnitus. And in some individuals, just the feelings or periods of high stress, anxiety, and depression can lead to tinnitus. So the most effective and most studied way of addressing tinnitus in the psychological manner is through cognitive behavioral techniques. Cognitive behavioral techniques have been found to help reduce and eliminate tinnitus in the majority of individuals. Cognitive behavioral techniques focus on altering the way you think, feel, and behave, because the way you view and react to your issues or problems like that of tinnitus affect your life in so many different ways. And by trying to address one area, just altering some of your thoughts or altering how you physically feel when you're actually hearing your tinnitus or even thinking about your tinnitus can help to improve the way that you eventually behave and the way that you eventually feel the next time when you are hearing your tinnitus. A lot of CBT focuses on meditation and mindfulness because the more calm and relaxed your mind and body are, the more easily able you are to change how you actually perceive and react to tinnitus. Tinnitus retraining therapy includes cognitive behavioral techniques. One of the main differences between CBT and TRT is that TRT always recommends the use of sound therapy. And as I mentioned before, when reviewing the audiological treatments for tinnitus, we know from the research that sound therapy really does help to improve tinnitus. In one study that was published back in 2006, they had individuals that had similar tinnitus functional index scores, and one group was receiving sound therapy plus counseling, which includes cognitive behavioral techniques, and the other group was just receiving sound therapy, and they did not have any education or counseling as part of their treatment. Both groups had their overall tinnitus functional index scores improve, but the group that was only receiving the sound therapy plateaued much sooner, and their overall degree of improvement was less than that of the group that was receiving sound therapy plus counseling. So again, this shows that using sound therapy alongside psychological, cognitive behavioral therapy can be one of the best ways for managing and reducing tinnitus. In a more recent study, they had 100 individuals with chronic tinnitus, and they subdivided them into two groups, one that was receiving cognitive behavioral therapy and the other that was receiving cognitive behavioral therapy plus sound therapy. Like in the other study, the individuals who were receiving sound therapy plus cognitive behavioral therapy improved and had a greater reduction in scores and much quicker than that of the group that was just receiving the sound therapy alone. There's so much benefit to having someone who can provide you more education and information about tinnitus, about how your hearing system works, about how this neurophysiological feedback loop has been created between your auditory system, your limbic system, which controls your emotional reactions and responses, as well as your autonomic nervous system, which relates information to how your body then responds to what you're thinking and feeling. It's such an important thing to have someone there to be able to talk you out of some of the negative thought patterns that can greatly contribute to greater perception and irritation with tinnitus. So having a psychological support team is so important for improving tinnitus and eventually getting you to a place where you've habituated to tinnitus. I've worked with many patients who, the first time I met them, I could feel how anxious and worried they are about tinnitus, about their hearing loss, about how it was impacting their everyday life. And once they started to get more information and have some of their questions answered, that overall anxiety started to reduce significantly. It in turn started to help improve their perception of tinnitus, and some of these individuals improved at a very rapid rate. So you can't discount the impact that psychological treatment can have on tinnitus. Like with most things in life, if you work through how you feel and think about them, you'll start to see them from a different angle. And our brain has this amazing capability of always highlighting what we view as important. Even if it's important because it's very negative and a problem that we view in our life, it will keep it front and center. And by learning ways to help shift your focus, deal with your emotions, deal with how you can actually alter the perception of tinnitus through your own emotions and physical reactions is paramount and one of the most important things outside of sound therapy for improving tinnitus. One of the biggest problems that most of our patients come in with is the fact that they feel that they've been discounted or dismissed when they've gone to different healthcare professionals regarding their tinnitus. And I think that if someone is telling you that you just have to learn to live with it or ignore it, and you find that you're not able to ignore it and live with it, it can cause a lot of physical and psychological stress. And that's where cognitive behavioral techniques really come in handy and really do such an amazing job of helping to reduce and eliminate the stress and anxiety that has developed over time as a result of hearing tinnitus. As an audiologist, we can provide cognitive behavioral therapy in regards to hearing loss or in regards to tinnitus, but sometimes issues are beyond our scope of practice, and that's where the second psychological treatment comes in, which is true mental health counseling. All of these things will indirectly help to improve tinnitus. In one research study that I found really interesting, they found that the likelihood of developing tinnitus was equal between groups of individuals with high stress levels as it was for individuals who are actually exposed to dangerously high noise levels. So I think it really shows that high stress can be just as detrimental and can impact and bring about tinnitus just as much as being exposed to very loud sounds that can cause damage to your sensory cells within the auditory system. The authors of the study also found that if you're exposed to loud levels of noise in addition to experiencing high levels of stress, this doubles the probability of you experiencing tinnitus. So as you can see, the contribution of stress and loud noise exposure is fairly similar, and it shows that it's very important for you not only to learn how to manage your stress and try to reduce it in your everyday life, but also protect your hearing if you're being exposed to prolonged levels of loud noises. As I had mentioned earlier, some of the treatments overlap. So for example, if you're experiencing extreme feelings of anxiety or depression, then you might be also treated medically via medications that help to manage those symptoms of anxiety, stress, and depression. And sometimes collectively, the treatments of psychological and medical can work in unison with one another to help improve the perception of tinnitus and reduce how it affects you on an everyday basis. There's a high prevalence of depressive disorders in individuals with chronic tinnitus, and a lot of studies have also found that as depression scores start to improve, tinnitus starts to improve in terms of decreasing in overall volume or overall awareness of it. And I've seen that a lot with patients of mine. Sometimes the first appointment, I can feel how anxious, depressed, or stressed they are. And as we start to work through different cognitive behavioral techniques, develop a sound therapy plan, individuals start to seem less depressed, less anxious. The amounts of questions that they ask regarding tinnitus starts to decrease. The amounts of worries that they express having surrounding tinnitus starts to decrease. And in time, they start to perceive their tinnitus as better, less bothersome, perhaps quieter. They're less aware of it throughout their day. So there's such a strong link between anxiety, depression, and tinnitus, and it's not something to be overlooked. The number 4 treatment is dental. Many individuals who have tinnitus also end up having what we call temporomandibular joint disorder, or issues with the temporomandibular joint. That's this part of the lower mandibular jaw that connects in with your skull. It's like a hinge. And sometimes individuals will experience jaw injury, or they may overuse their jaw because of teeth clenching, or they may grind their teeth at night, and it can damage the jaw as well as the muscles attached to the jaw. People often ask, well, how does having a physical injury also play into hearing tinnitus? And the fact is that the somatosensory system makes contact with the auditory system at the level of the dorsal cochlear nucleus within the brainstem. So information from both of these systems meet up right there. And if you're experiencing pain or discomfort, it can start to coincide with auditory information that then develops in the perception of tinnitus. We don't exactly know what causes temporomandibular joint disorder in most individuals. It's sometimes very difficult to pinpoint the precise cause, but there are some general treatments that are given for individuals that are believed to have temporomandibular joint disorder. Oftentimes, night guards will be recommended for individuals with TMJ because it can help alleviate bruxism, which is teeth grinding or teeth clenching in the middle of the night that might be contributing to the pain and discomfort that one is feeling in their jaw. A dentist may also recommend Botox to help fixate and constrict the amount of movement in the jaw, and that may help to reduce the amount of jaw pain as well as reduce the overall perception of tinnitus. In some cases, they may also recommend that orthodontic work be done because of the misalignment in the jaw, and so realigning the jaw through braces, for example, may help to alleviate some discomfort in the temporomandibular joint, which then can have benefits towards tinnitus. One study found that individuals that had temporomandibular joint disorder were 1.6 times more likely to have tinnitus than individuals without it. So it's something worth investigating with your dentist to see if that may be an underlying cause for your tinnitus, and if treatment can help improve temporomandibular joint function, then it may also help to improve tinnitus. It's also worth mentioning that if you have to undergo a lot of dental work, or if you've gone through a lot of dental work, you may have been exposed to very loud sounds. We all know that having the dentist use a drill can be very loud, on top of the fact that when they're making contact with your teeth, it's directly stimulating your inner ear or cochlea through bone conduction. The sound is also coming out of your mouth and circulating back into your ear. So you have a higher chance of experiencing some temporary tinnitus or noise-induced hearing loss if you've had extended dental work completed. We also know that dentists are more likely to have noise-induced hearing losses because of the equipment that they use on a regular basis. So if you're a dentist, I highly recommend getting noise plugs, custom ones that allow you to still be able to speak and communicate with your staff and your patients, but ones that help protect your hearing as well. And the fifth and final treatment for tinnitus involves physical interventions. You may have heard the term somatic tinnitus or somatosensory tinnitus. This refers to tinnitus that is caused by the modulation of physical actions, touch, movement. It can happen as a result of activation of the somatosensory, somatomotor, or visual motor systems. The majority of the evidence surrounding what causes somatosensory tinnitus is believed to be the result of altered or cross-modal synaptic activity within the dorsal cochlear nucleus, which is part of the central auditory nervous system, and another subset of the central nervous system, specifically another sensory subset of the central nervous system, be it the visual or tactile systems. Somatic tinnitus or somatosensory tinnitus is usually caused by physical damage or trauma, injury to the head, neck, or jaw. TMJ also falls under this subcategory. So there's physical treatments that you can undergo to help improve symptoms of TMJ, or if you have had a traumatic brain injury, a concussion, a blow to your head, or some kind of injury to your neck. These are some of the more common treatments for those conditions that have been linked to tinnitus. So we may recommend that you see a physical therapist, a chiropractor, you may receive craniosacral therapy, acupuncture, Botox. In some cases, again, you might be referred back for surgical intervention. So all of these different treatment options are available, and some of these work better than others depending on the ultimate cause for one's tinnitus or contributing factors to one's tinnitus. All of these treatments have been found to be helpful and beneficial in some cases. There's a wide range of individual variability, so if it's deemed to be safe by your physician, then it may be worthwhile trying to see if it helps to alleviate your tinnitus to some degree. A lot of these treatment options are safe and not likely to cause your tinnitus to worsen to any degree, so they may be worthwhile trying as long as they're deemed safe by your medical provider, your physician, and you may find that you also enjoy receiving some of these treatments. It can be very relaxing to go to the chiropractor or to get a massage, and feeling relaxed is a vital part of improving tinnitus. And you can see here how many of the different treatment options overlap with one another, and you may benefit from having more than one treatment that falls within different categories. It really just depends on you as an individual, what causes seem to be the ones that brought about your tinnitus, and what you feel most comfortable trying. One great example of how an individual can have multiple treatments that fall into different categories and in turn, they improve their tinnitus is from this one study that was completed on individuals with Meniere's disease. Meniere's disease is a disease that is categorized by fullness in the ears, fluctuating hearing loss, perception of tinnitus, as well as bouts of vertigo. So they found that individuals with Meniere's disease were more likely to have TMJ, temporomandibular joint disorder, as well as cervical spine issues. And they found that individuals that were receiving treatments to help alleviate TMJ, as well as their cervical spine instability, had improved scores in terms of how they were perceiving their tinnitus and how their tinnitus was impacting them after having received this treatment to address the TMJ and cervical spine issues. Tinnitus is very complex, and the factors that cause tinnitus for one person may not cause tinnitus in another. And that's why we have to individually create a treatment plan that best addresses that person's tinnitus. And oftentimes, using treatment plans that fall under more than one category are the most effective. A multifaceted approach tends to be the most effective way of managing tinnitus. So looking at the audiological treatments, sound therapy, hearing devices, medical interventions, the physical components that may be contributing to tinnitus, taking all of these things into account is so important and necessary, and it's one of the things that I think we do so well here at Treble Health. We really look to evaluate what are the individual causes for your tinnitus in order to develop an individualized treatment plan. If you enjoyed this video, please hit the like button. If you haven't already subscribed to our channel, please subscribe. And if you have any other comments, please don't hesitate to comment below. Thank you so much.